Appendix surgery update is here. Alrighty. I went into the system and I looked at the two patients. It looked like Abigail had appendicitis based on like the lower pain, abdominal pain. So I grabbed her. I wasn't sure if it was going to be appendicitis or tumor, but just based on those symptoms, I thought so. So I grabbed her. They did some updates. So they have everything kind of in one area. You get your towel, your gown, your mask, your gloves are across. This is the closet of supplies, so that's where you get your sheet to make the bed. Now we're waiting for Abigail to come in. It's really nice. The NPCs have gotten a lot better. So I was messing around in this OR before. The lights are already on, but it's going to tell you to turn on the OR lights. That's the switch back here. Okay, and then in a minute, I'll introduce myself. Okay, and then I go get the sedative from the closet. You can just type in SED and then go put it in the IV. This is very similar to the tumor surgery. It's almost exactly the same, but that's okay. We have a new surgery, so that's all that matters. Just wanted to show it to you. So this is the saline that we're putting in. Okay, she's falling asleep. Now we're going to get the bowl of betadine next. Okay, yes. So we're going to go to the closet. We're going to grab our bowl. And they have a separate table for it now, which is great. And then you're going to grab the green bottle and fill the bowl. Then you're going to grab sponge. So it's scissors with a sponge on an end, so it just looks like scissors, and then use, and then that cleans the patient's skin. Okay, and it's nice because they put the instruments in your hand now, like the scalpel and the cauterizer go in your hand. So we use the scalpel, we cauterize, scalpel again, cauterize till it's green, till that circle is green. And then it's really nice. It tells you your accuracy. So you can try and improve every time. Here's the clamp. And this is where I found out it was appendix because it says it. I'm like, oh, yay. Okay, and then you clamp it again. I'm really bad at this. I'm so bad at cutting around things. Now we're going to cauterize again. This little line here. My accuracy is not good. Then you drag the appendix out. Cauterize again. Stitch her up. And again, they give you the tools in your hands now, which is really nice. Okay, so the NPC is bringing her to post-op, and then it'll tell you to grab the appendix sample to put in the tube system. Oh yeah, let's take off all of our gowns, which is a nice new added addition. Our sample is on the tray next to that bowl in a yellow cup. We bring it all the way down the hallway into the tube system. There we go. And then we log into the computer. I usually type surgery complete, but then look, you get 40 points and then you're done. I went back in to sign in to see who is next, just to show the difference. So you can see Joseph and Amanda. Joseph looks like he has tumor because he has